As more sectors continue to receive their first doses of the COVID-19 vaccines, the health department continues to report more cases and more patients dying under difficult conditions. How can government save lives as it continues to roll out the vaccination program? We discuss in this episode of The Chiefs. Welcome to this Thursday edition of The Chiefs. With us, of course, Ana Marie Pamintuan of the Philippine Star, Lucy Cruz Valdez, the head of News 5, and coming online in a few minutes should be, there he is, Abel Ampay of One News.
Good evening.
Hello, everyone.
Ano meron? Ano lang niyo? Ano meron? Dahil Huwebes ngayon.
Holiday bukas.
Long weekend na naman.
Yung AstraZeneca, binigil sa mga below 60.
Oo, nakakatakot yun, ah. I mean, di ba, ang dami nating nababasa mga adverse effects, pero laging sinasabi, napakaliit na first, kaya konektado yan sa isang comorbidity or whatever, no?
Yeah.
Pero ito, parang for the World Health Organization to decide this, di ba? That means this is more than just talk. This
Tapos kung nobody below 60 years old, that's how many percent of the population?
I know, right?
Ang labas
Saka you have to repeat that. You have to repeat that. Kasi, you have to repeat that. Kasi ako, I had to check again. Kasi usually, ang mga caution is for people above 60.
Above
60.
Do not use for people above 60.
Tapos, on the other hand, yung ivermectin naman, inapproved for compassionate one hospital.
So, there's one hospital na pinayagan. Yeah.
And interestingly, yung pinayagan nila, for one hospital with a specific set of patients, not for the hospital in secular room. In other words,
kasi you have to apply for it.
Kasi yun yung nag-apply.
Yeah.
Hindi yun nag-grant.
Kausap ko kanina si Yusek Dominga. Una-una, hindi sa AstraZeneca, meron din siyang sinabi. Sabi niya, actually, it's a good time to pause on AstraZeneca if only because nagkataon, paubos na rin talaga yung AstraZeneca. That's one thing he said. So, tama-tama sabi niya, it might take about 2 weeks to wait on the findings on AstraZeneca. And then dito sa inuulit niya, this is not a general permit. It is not for commercial and for marketing of ivermectin. It is a specific hospital for a specific set of their patients right now.
Their patients.
Yes, but at least it's clear now that you can actually go to a pharmacy that compounds it, no? Once you get the permit, you can actually do that if you have the prescription. Dati kasi it was a general blanket. Don't buy anything like that. Doctors should not prescribe it at all, di ba? So ngayon, there seems to be, a softening.
Softening. But anyway, 9,700 na naman yung kaso natin. Siguro, tanungin na natin yung test natin. Kung ano na naman yung mga projection, parang...
Yun na ba yung 9,200 ko naman,
Dinagdagan mo ng 500.
Ikaw, number parting ka, matagal pa election.
Wala po yung mata na nababasa ko. Sige,
Okay, let's bring in our first guest for tonight, si Professor Guido David ng OCTA Research, one of our favorite guests. Hi, Professor. Thank you for joining us and welcome back to the Chiefs.
Good evening,
Hi.
Professor
Guido.
Good evening, everyone. Yeah.
Good evening, Prof. Prof, kasi ang daming nuancing kasi nung after Holy Week, ang daming kailangan mong inuance dun sa mga numbers. So hindi namin malaman tuloy kung how to look at the numbers that we've been getting in the past 2 days. Today 9-2. Before that, mga 9 or 8. So doon naglalaro. How should we be looking at the numbers these days after Holy Week? Are things looking up or are things not yet settled down?
Yes, hi, Ed. Well, mahirap sabihin yung if things are looking up, medyo nalito ako this question mo. I mean, if you mean by numbers are going up or if it looks...
Kasi Prof, remember, you were talking before about after Holy Week, we were expecting an artificial dip because nagbakasyon yung ilang testing centers. Also, merong Tuesday, Wednesday, may Tuesday, Wednesday, thing na bumababa artificially, historically, yung numbers eh. So, hindi namin malaman ngayon kung how are the numbers now? Are they artificial pa or are they really reflecting what is happening now?
Yes, Ed, and you're right. There is a Tuesday, Wednesday normal drop, and that's why yesterday and on Tuesday, I think we saw rather lowish numbers, mga nasa 6,000 plus. In the NCR today, we got 4,300 cases. Yung reproduction number natin is as of today, it's 1.24 in NCR, which is not bad. I mean,
yeah.
1.24, yes. So there's a significant improvement. In fact, we may be below 1.2 by Sunday. So that would lead to an important decision for the national government. Kasi 1.2, it's not yet 1, but it's close. So what do we do? Those are decision points for the government. We are also seeing some changes, trends. Many cities in the NCR, particularly Pasay City, pababa ng cases sa Pasay City. Yes, you're right. There might be an incomplete picture yet kasi testing was lower by 17% during the previous week ng holidays. Parang nabawasan tayo ng 17%. But I think there's already a correction factor. May correction today, and I think tomorrow yung correction. So I think overall the trends are still promising.
Prof, pahabol lang, yung 1.2 na reproduction rate is like when if we compare it, para may idea tayo lang what is 1.2 like. It's like January, December, ano yung 1.2?
1.2, yeah, that would be close to well, at the start of the surge, mga late February. So we haven't seen that kind of a low reproduction number. But of course, this is the reproduction number. This is not, I mean, yung daily cases natin, we're still averaging about 5,000 sa NCR. So yung base number natin, mataas. And even if pababa na siya, we're starting from a higher point now. Going down. And that would mean that hospitals will still be full for a while. Kasi kahit na mag-downward trend na tayo, hindi naman agad-agad na bababa yung cases significantly. I mean, even if it goes down slowly to 4,000, for example, that's still a lot of cases. And ang pinaka-problem dito yung healthcare system natin.
Professor, ang tanong dyan, sustainability din ng nung trend. Tama na ba yung, obviously, the ECQ is working. Siyempre, ang tatanungin ng mga tao, tama na ba yung 2 weeks? Siyempre, sinasabi ng economist, hindi na natin kaya yan. Pero kayo, of course, people will ask you again, ano sa tingin nyo, do we need at least 1 more week para lang maging sustainable na itong pag-slow down ng transmission?
Well, as a group namin, we're talking about this, and some of those in the group will strongly feel now we should strongly consider extending by maybe at least 1 week. And kahit hindi ECQ, kahit maybe MECQ, I mean, of course, ECQ is possible. Maybe MECQ, since malapit na siya sa 1. We are, of course, cautioning against yung prematurely opening. We have to think that carefully kasi, we don't want to be put in a situation na pag re-open natin and magdagsaan na naman yung mag-spike yung cases. Right. Because right now, I mean, I know a lot of people, ako personally, who have gotten sick or who have gotten COVID. And this is alarming. I mean, this is really, I think, as bad as it gets. And this might be the last major surge that we will see because vaccines are starting to come in. And in fact, I gave a presentation today sa FEU. I talked about vaccine rollout. And one of the findings that we have is when we roll out 1 million vaccines, ang equivalent niya, pwede niyang pa-reduce yung reproduction number by 0.1. So if we, so kanyari ngayon,
Professor, Professor, is it, Is it too early to ask you kung ano yung projections nyo by the end of April, a high and a low, an optimistic and a pessimistic, assuming that one, things hold and that the ECQ is either extended or not extended? I only ask, I mean, not to jump ahead of what we usually ask you, but I figure obviously that's the compelling thing, di ba? You need a compelling target, and something that can help convince people, okay, that's a worth target or not. Is it too early to ask you what's the projection for the end of April?
Well, yes, Robbie, it's actually too early. We might have it by tomorrow, so wala pa ngayon. A few days ago, we mentioned we might hit 1 million cases total by end of April. I think that's still within the target. So if we're talking about the range, it could be plus minus 50,000, for example, from 950 to maybe 1,050,000. Rough estimates lang yan. We will refine it by tomorrow. We're going to put out a report tomorrow. It's, by the way, 1-year anniversary ng reports namin. Our first report came out April 8th of last year. So today's actually parang birthday ng first report namin.
How we wish we could greet you a happy anniversary.
No.
Yeah.
Ite-text na lang namin sa private chat yung address namin para sa blowout nyo.
Sure, and I wish you could greet us, Lucy. Kaya lang, this is an anniversary now. We don't mind if we don't even have it, kasi if we don't have it, that means we don't need to come out with reports kasi everything's okay now. Pero like I said, this could be the last major surge because vaccines are rolling out, and if we could get sufficient, maybe 5 million, 3 to 5 million vaccines in the NCR, malaking matutulong yan. Like I said, 1 million vaccines would correspond to a decrease of about 0.1, the reproduction number. We have another paper that we wrote. It says now we don't even need 70 million to get herd immunity. Our target's 35 million. Yes, we did some calculations. And
35 million for the whole country,
why is that?
Whole country,
for the
yes.
whole country? Oh,
yes.
Why is that? Why is that?
Yeah,
because yung 70 million, that's yung sinasabi lang 70% actually. That's just a rough estimate. That applies generally, but when you do an examination of the details, kunyari, there are certain regions na hindi naman ganun ka high risk, and we haven't seen a surge happening in these regions. Like for example, Ilocos Norte, Ilocos Sur, Bicol regions, they never had a major surge. So they actually don't need 70% to get herd immunity. There's a formula for that with the calculations, and they need maybe just 15 to 20% of their population vaccinated. But for NCR, we do need about 75%. May sobra pa para ano. But
in the whole country,
in the whole country, it's about 33% lang ng population. So we actually don't need to acquire that many vaccines. And marami kasing nagsasabi na, how many years will it take us to get 70 million? Pero if our target is much lower, 35 million, it's doable. Maybe it could be done this year pa nga. It's possible if we get a significant number of rollouts.
Okay,
so if
the vaccines are coming anyway, is there a need to ramp up testing pa? I mean, kung darating na rin lang, and di ba yung positivity rate and your numbers are all based on the number of tests, no? Is there still a need to ramp up testing now? Will that help? How do we read the numbers given the amount of testing now that we're getting?
Yes, Lucy. Right now we need testing kasi the surge is still here. Yung vaccine rollout natin, we won't get to 5 million by this quarter. I mean, I hope we do, pero it's a stretch if we could get to. I mean, hindi naman stretch, but it's more of an optimistic outlook. I think if we get to 5 million, or I think it's something now we would be happy if it happens if we get 5 million vaccines by this quarter. Pero testing is always needed at this time. because we don't have enough testing, and we have to rely on antigen testing. I mean, once the vaccines come in, we'll still need testing. We won't need as much testing kasi the cases will be lower now. We will be able to control the number of cases due to the vaccine. Pero for now, we still need testing.
Pahabol lang, you want the vaccines to be focused, to be poured into the NCR, preferably.
Yes, Amy. Especially since NCR is the highest risk, it's also the economic center, and everything else goes through the NCR. So if we can control the surge in the NCR, and if we can prevent outbreaks in the NCR, essentially we'll be almost preventing outbreaks in other regions. Of course, we will still need to vaccinate a lot of people in the other regions, pero hindi as much. In Calabarzon, I think we need mga 50%, rough estimate natin. Pero all the other regions are much less than 50% vaccination yung necessary to get herd immunity. Pero once we get herd immunity sa NCR, there won't be an outbreak in the NCR, and that is very, very important moving forward.
Prof, before we let you go, can I ask you one more question? Yung 1 million na sinasabi nyo na vaccination equivalent to 0.1 ng reproduction rate, is that for every 1 million or does the number change for every additional million?
Well, yung 1 million, yung 0.1, of course, is an approximation. So we looked at it from a simulation of 1.3 reproduction number. Tapos pag nag-vaccinate tayo ng 1 million, nagiging 1.2, tapos another million, nagiging 1.1. So kumbaga, if we're at 1.3 kunyari now, and we vaccinate 3 million, mafa-flatten na natin yung curve. So we don't even need, we'll still need to maintain some sort of, GCQ siguro to retain that level. Pero, we could get that reduction in the reproduction number instead of forcing it using lockdowns. And that would be, I'm sure that's something that will be welcomed by the economic, the business people, business community, especially since they will be trying to bring in vaccines then on their own initiative.
By the third quarter, yeah.
Second quarter,
sana nga. Yeah.
Pero Doc, if you vaccinate 10 million people, that's equivalent to the integer of 1. Di ba?
Yes. So parang ganun na nga. But of course, those are estimates. If we vaccinate 10 million, we will get herd immunity in the NCR. Pero we're not going to be able to vaccinate 10 million people now kasi we have about almost 30% na children from 0 to I think 15 or 0 to 17 na who will not be eligible for the vaccines, and then meron pang mga seniors who will account for they're siguro less than 1 million of the 13,800,000 in the NCR, and then of course meron yung mga may vaccine hesitancy. Pero my good friend and colleague, si Professor Ranjit, had his first shot today, so I don't know how he's doing. So I asked him if he could make it today, pero nagpapahinga yata siya because, baka stressful sa kanya to get the first shot. Yeah, it's good.
Okay, Professor Guido David, sir, maraming salamat for joining us tonight.
Maraming salamat po. Happy anniversary.
Thank you. Thank you, and good evening. Thank you.
Okay, let's bring in our second guest for tonight, si Dr. Jean Nisperos ng grupong Second Opinion PH. Dr. Nisperos, of course, he's been with us before. He's also a professor of the UP College of Medicine. Dr. Jean, maraming salamat for joining us tonight. Welcome back to the Chiefs.
Yes.
Good evening, Doc.
Thank you very much for the invitation. Good evening po. Yes, glad to be here po.
Doc, I suppose question foremost on everybody's mind, anong pananaw ninyo? Tingin nyo ba kailangan i-extend itong ECQ for one more week? Or sulit sapat na itong linggo ito?
Well, we never, thanks for that question. We never believed that ECQ was the solution in the first place. It can cause a false belief that we're actually controlling the disease spread. But unless we actually do the basics, like testing and contact tracing that is appropriate to the population, we're not going to, no matter how many times we do an ECQ, the resurgence will always occur. And that's the problem. This is not the first time we've had the resurgence, actually. This is about the third time from March last year. And every time we come back to a resurgence, it seems that the government's starting from the basic or from the start, because it hasn't done anything that is really definitive to address the COVID pandemic. So every time a resurgence happens, we just go back to the first. In fact, if we were prepared, we should not be starting from where we left off. We should be starting from somewhere we left off. Kumbaga, pa-improve.
Okay,
Yeah.
so last year we remember that you had a 6-point plan. Okay, now we have this surge. Okay, if you were to map out a strategy to put an end to this surge now, what would be your plan?
All right. Based on the 6, the first would be to strengthen the communities. The fight against COVID doesn't start in the hospital. It starts in the communities. That's where the transmission occurs. So you empower communities. What does that mean? You make sure that everybody is aware of what the plan is, what their role is in that plan, and make sure that they have a sense of ownership for that plan. Tapos the mechanism should be in place, like let's say the BERTs or the Barangay Health Emergency Response Teams. They should know what they're doing. They should be well informed. They should be given the resources, and they should know within the city or within the municipality where to refer patients once they start coming in. At the same time, people should know, meron akong symptoms ng COVID, kailangan na akong mag-report. That is part of health promotion.
Hindi pa ba nila alam yan? Hindi pa ba nila alam yan ngayon?
Hindi, alam nila, pero ang daming in denial, ang daming hindi alam ang gagawin, kahit alam gustong gawin yon. In fact, kahit ang daming nagre-refer sa amin na kinokontak nila yung births nila ngayon, hindi nila makontak. Because even the births are overwhelmed. You know, this is part of disaster preparedness. And pandemic is a part of is kind of disaster. So we never had that. That's the first, because the WHO has been calling for empowered communities to be part of the solution. The current narrative is pasaway yung mga tao sa community, therefore kumakalat. So we have to reverse that. The second is control transmission. Now, how do you control transmission? Is you identify where it's happening and how far it's spreading. We haven't done that. Testing is so inadequate. So even if you vaccinate people, millions of people, we don't know where the disease is spreading, but transmission will never be controlled. That's why we're not, so yun yung 3 na yun, dun sa 6 na produce ng WHO recommendation. The fourth would be to make sure that the workplaces and schools where infections can happen have the adequate health committees or health monitoring, so that even if workers go back to work, they're ensured that if they feel something, they have someone to ask, they have somewhere to go, and those things. And then I think the only thing that the government has been able to successfully implement is making sure that transmission in high-risk places like hospitals is controlled. In fact, if you go to a hospital now, mas maganda yung infection control doon, kasi they're making sure that the health personnel are not affected or are not infected by the disease. So if you're looking at the 6, out of the 6, after 1 year, we've only done 1. And until now, in fact, the sad part is we're still trying to, they're still debating ano ba ibig sabihin ng mass testing, when everybody else is just saying that we need to test more. We're not testing enough. And if we don't test enough, we're never going to see where the infection is. Yeah.
Doc, yung isa pang sinasabi kahapon ni Navotas Mayor Toby Chanco is, ano ba ibig sabihin ng bringing in the LGUs and bringing the triage down to the communities? I guess this goes to your point din kanina, na on the one hand, people are told, hindi, alamin mo yung kailangan mong gawin sa level mo pa lang. But he was saying, but the reality, if somebody in my barangay, in a barangay sa Navotas gets sick, didiretso yun sa ospital. And kahit anong preparation namin for triage dito, kahit maglagay kami na, kung dumiretso yun, hindi nagsabi sa amin, wala rin kaming gagawin. So how do we even start to intervene on that particular cycle at that level of community?
Well, the LGUs themselves have already articulated part of the problem. The national government is making announcements na ginagawa namin to, pero pinapasa lang nila yung trabaho sa LGU. Wala talagang support, both technically and in health human resource, in funding, because these things need to be done. And the narrative has to be reframed, because kaya naman natatakot yung isang pasyente na may COVID ako. Kasi nandun pa rin yung kaba sa kanya na ang mahal kasi magpagamot. Saan ako pupunta? Wala akong pera dyan. That has always been a fear of many Filipinos. And saying that PhilHealth will cover you is actually telling them, you have to go to the hospital. Kasi pag nandyan ka lang sa health center, hindi ka naman sasagutin ng PhilHealth. You have to be admitted. And we know that already because yung mga nasa tents nga na nasa hospital na, hindi pa covered ng PhilHealth. So, ang daming concerns that we had a year to address. We had a year to inform our people that, look, if you get sick, if you do this, halimbawa ako, nagkasakit ako and I need to quarantine myself, somebody will bring ayuda to you so that hindi ka na kailangan lumabas. You don't have to go out and buy food. The birds will come in and supply you food. Yung mga ganyan, hindi yan nadidiscuss ngayon. Hanggang ngayon, hindi siya na pag-uusapan. The conversation needs to go down to the communities. And for the longest time, if you remember, for a year, always been told just to follow minimum health protocols. Wear your mask, maintain physical distancing of 1 meter, wash your hands. I mean, people have been doing that, but everybody knows that we cannot address the COVID pandemic by just doing that. I mean, even if all Filipinos do that, hindi yun sapat. So we need to do more. But what was more? Walang ganon eh. There was no leveling up of interventions, even during the time that we didn't have this surge. And now that we have this surge, everything that we were trying to talk about before is being put front and center. Testing, contact tracing. I mean, we're wondering why we're only having this conversation now when we were already proposing effective contact tracing. I mean, Magalong was saying we have decreased our contact tracing from 1:7 to 1:3. What is the WHO recommendation? 1:10 to 30. Ang layo, ang layo, even when we were doing it. So we're really failing on a public health level. And the pandemic is a public health crisis. So we can't rely on just vaccines. Yeah, go ahead. Yes.
Doctor, may dagdag na factor of course ngayon compared to last year, yung variants. Sobra siyang kumalat ngayon sa mga household. Kaya yung ibang tao, isa lang ang ma-infect sa bahay, takbo na sa ospital eh. Natatakot sila na yung buong bahay nila. Ano kaya na-overwhelm din yung hospital? Ano pa yung mga doables nun to deal with this problem? Kasi talaga namang nagkakawat sa mga households.
Yes. Well, for one, we need to triage better at the community, at the LGU level. So yun yung sinasabi ni Mayor Tangco na dumidiretso sa hospital, kailangan mabawasan yun. Of course, we need to inform people that if you are having moderate symptoms, let's say, medyo hirap kang huminga pero kaya-kaya pa, at dahil puno naman yung hospital, we can bring you to this facility where we can give you, let's say, oxygen support and proper care. Kung hindi ka naman nangangailangan pa ng intensive care, baka pwede ka muna dito sa isang facility. We don't have that. We don't have those. And then at the level of LGUs, they're still trying to triage. The district hospitals, are the district hospitals prepared? Are the provincial hospitals prepared? Dumadagsa yung mga tao doon sa malalaking hospital kasi nandun yung ICUs, and they believe that big hospitals is the solution. So even if patients who don't need that intensive care are going there. So again, before sana umabot sila sa hospital, nandito sa baba yung triaging, nandito sa baba yung pagbo-monitor. If we also encourage people to report early that they have symptoms, the BERTs and the city epidemiologic and surveillance units can monitor their development. Gumagaling ba sila? Are they getting worse? So the LGUs can predict how many people are getting worse, how many people are getting better, and they know now which facilities to bring these people to. But unfortunately, we don't have that. Again, we still don't have that. And those things we can do immediately, but as the LGU said, they need support from the national government. The national government can say, yeah, go ahead.
Yeah. Ang nakakapagtaka, some government officials have actually pointed to devolution of health services to the LGUs as kind of like an obstacle, in addressing the COVID problem we have now. Kasi nga naman, even if they issue a policy from upstairs, parang yung implementation kanya-kanya na. So
That's
hindi nila talaga raw na monitor. So, but you're suggesting that it has to be on a community level.
That's right.
Paano mong marireconcile yun na ang feeling pa nga ng government ngayon is dapat kasi centralized pa rin. So they're seeing the weakness of the devolution. What are your
That's right.
thoughts on that? Yeah.
Well, the pandemic actually exposed all the flaws and weaknesses of our healthcare system. One of which was brought about by devolution. Devolution allowed the local government to plan and invest in their own healthcare. Unfortunately, not
Yes.
all of your local officials saw health as a major investment field or area. So pinabayaan yung healthcare. So ngayon, nang may pandemic, hindi makaagapa yung local health system. Now, that is a problem brought about by devolution. In a pandemic that actually exposes these problems, hindi pwedeng sabihin mo, oh, bahala ka dyan. Hindi ka nag-invest sa healthcare system mo, bahala ka dyan. In fact, in this kind of a situation, there has to be parang isang kumpas. We have to command everything. In fact, it's not just LGUs that we need to muster to work together. You can imagine private hospitals. No? I mean, we're talking testing halimbawa. Hirap na hirap mag-test sa public. Pero yung mga private testing centers, meron pa silang test. No? So why can't we commandeer those and make sure that all of these testing capacities can be put under one command, for the lack of a better word, so that everybody can access testing and have more people being tested, rather than testing still being a matter of how much you can pay or when you can access it. So mga ganon, ano? So even if there's devolution, what we really need now is like how would I say, a synchronized, parang symphony na may isa kang conductor, tapos lahat ng sections ng isang orchestra, nakikita niyo gumagalaw sa isang kumpas niya. So that things will move together. Unfortunately, you have government saying na, oh, yung mga LGU na kayang bumili ng bakuna, mauna na kayo. Or yung mga, so hindi ganun ang pagpapatakbo. And even different agencies of government are saying may different things. So nagkakaroon ng disjoint doon. So you take all of that together, we have a pandemic response that is not synchronized, that is not unified. And the saddest part is nobody knows what that pandemic response looks like.
Do you have to? I mean, do you have to tinker with the local government code, or is this just a matter of leadership?
I think we don't have right now. We don't have to be tied down by laws like the local government code to go around it, because there is a crisis, and if we have the will to do it, I think we can actually say, let's work together. The government is doing now, like what the government is doing now. They're getting health personnel from Cebu and bringing them back to Manila. They can do that. So why can't they do it to other aspects of our pandemic response? I mean, we are in a crisis. And the moment we acknowledge that, then we have to muster all of our resources and put them in line so that our approach is better directed. Kumbaga, parang sabay-sabay.
I understand the point of in the framework. I understand the point of in the framework of the emergency that we're in right now. Government can invoke police powers. They can invoke emergency powers and so on. What I was fascinated by was the thought of the new normal emerging from this. Let's say we're past all of this, and you're saying we've seen the flaws of devolution and so on. That's what I'm trying to see. What do you see beyond this as far as local government code is concerned? Can we use that, take leadership to make it synchronized as possible, or do you actually need to tweak it, or do you see a hybrid system of some sort?
I think, personally, I have always believed that healthcare shouldn't have been devolved in the first place, and this is just proof for me. But if you're looking at it, then maybe we can do a how would you call it? A graded renationalization. For instance, rather than in total just renationalizing the entire healthcare system, because that's going to be difficult, and local government officials will definitely refuse that because it will entail loss of some income from them or resources. For instance, why don't we renationalize all of our health personnel so that they all so that we can reallocate where we need them, and pantay-pantay lahat ng health personnel natin. Hindi siya umaasa sa local government. And your health personnel has that independence of saying, look, this is what the DOH is saying, this is what we need to do. Ganon. Hindi siya tali sa local politics and local situations. At the same time, your health personnel becomes insulated from changes in political fortunes within the local government. Kasi nangyayari ngayon, pag hindi ka gusto ng mayor o bagong governor, pwede kang palitan. No? So, nangyayari yan all over. So I think that's the answer for you, Robbie, na we may not be able to renationalize the entire healthcare system in one go, but the fact that we are seeing now problems engendered by devolution means that we really need to address that squarely. It used to be an elephant in the room. Every time we discuss health policy, healthcare, just nobody, because it was taken as a given. But now we see that it's working against us. And it's not just the pandemic that's revealed it. It's just the pandemic just aggravated the problem that's already been there for the longest time.
Okay.
But Doc, do you see anybody in government moving in that direction that you're saying right now? Basically, is it
That's
even on
true.
the table? Is it even on the table? Is it even being discussed?
I think there has been legislations in the pipeline regarding renationalizing the healthcare system. Again, it's caused a lot of there's been a lot of obstacles because again, local government officials will simply not agree to it because when the healthcare system was devolved, a big chunk of the national budget was devolved to them.
Right.
But now we're seeing this problem. So one of the measures, I think one of the intervening measures that government can do is to make sure that kasi there's compulsion or compulsory
Mandatory.
local government
There's no.
local government are not compelled to spend the devolved funds to them on healthcare. So they can actually underspend on healthcare. When in fact, they should be spending
they can shift
that much for Yes. So walang ganon eh. If the national government can compel local government to spend 15 to 16% of their IRA on healthcare, that becomes a big thing. Right now we're spending what? Between 9 to 11 ang baba. So hindi talaga nakaka-invest. But again, that's only a temporizing measure. We really need to address the problem of how devolution can be addressed given that it is showing itself to be a problem when it comes to nationwide health problems like a pandemic.
Pero sasabihin ng mga LGU, bumabagal nga daw yung mobilization nila under national control eh. In fact, pati itong vaccine procurement, nagrereklamo sila. Well, not all of them will say it openly, pero yun ang sinasabi nila, mas mabilis daw kung didiretso na lang sila ng
sila mismo.
procurement nila. Yes.
But also,
Yan
tama
ang
po
isa
yun.
ngayon eh.
Tama po yan, Ami. Pero that's always been part of the other side, the other position. Bakit may bibigay sa DOH yan? If DOH itself is not functioning well, if DOH itself has its own problems. Well, for me, the answer would be if you renationalize it, you're only holding one agency accountable. Without that, you have to hold all of these LGUs accountable, different LGUs, and you may have an LGU right now that is functioning well, that has put importance on healthcare, but a few elections down the road, magbabago na yung priorities ng LGU na yon. And yun yung problem. Whenever a new
don't you also have a premise there? Don't you also have a premise there of a very effective and very efficient national government? Because a lot of people are not. On the other hand, if you take it away from the imbalance of local governments, you put it in the context right now. If you put it in the context right now of the DOH having full control of all the entire workforce, a lot of people are very skeptical with the current dispensation.
All right, that's a good point. That's why devolution doesn't just mean that it's not a single act. No? Parang what we are saying is we really have to overhaul the DOH at this juncture. We really need to overhaul. Well, not just the mandate. Some of the DOH yung mga bureaus niya is not working in consonance with each other. So the DOH itself has a lot of problems. As we can see it now, kahit sa data management nila ng COVID data, hindi nila maayos isang taon na. No? So maraming problema ang DOH itself. So my answer, Robbie, would be, even if we push for devolution, we need to make the DOH more effective. And that is part and parcel of reversing devolution. But we have an experience now if you look at the way the DOH is functioning, it's already relying on just deployment. What do I mean by that? You have local governments who don't have enough doctors and nurses, and the DOH is already deploying, is sending nurses
Health
and doctors to
workers
these
from
areas.
other regions.
Yes.
Yes.
Well, even its own health human resource development program
So,
and plans are anchored on deployment. Now, you have a nurse deployment program, you have a midwife deployment program. Even the Universal Healthcare Law, yun ang nakasulat doon. Deployment pa rin. Walang development of local government health workers from the grassroots up to the national level. Whereas before, pwede kang MHO, magiging PHO, magiging regional officer ka. May ganong track. Nawala yun with devolution. So, we're already looking at the national government supplementing local government units anyway in terms of health human resources. So why don't we just make it official and make it more systematic so that your hindi lang deployment. If kasi ang deployment may limit 2 years, 3 years. Kung talagang tinutulungan ng local government yan, tumatagal yung health worker, yung doctor, yung health professional, yung nurse, yung midwife dun sa lugar. Hindi pwedeng palit every 2 or 3 years. It's not a sustainable health human resource development program. So yun, siguro yun.
Well, also because the different LGUs have different budgets. I mean, range,
That's right.
diba? Kung era-based kasi yan, ang dami naman talaga mga regions na halos wala nga. Ang dami mga LGUs na talagang nagkukumahog, scraping the bottom just to be able to get funding for their projects. No? So siguro nahuhuli yung healthcare in their list of priorities. I mean, will what you're suggesting actually solve that? Because at the end of the day, it's really about LGUs being truly autonomous also financially, right?
Right. True. I'm not saying that devolution doesn't work per se. I have actually seen it in countries where the city has a strong control over its healthcare and actually decides, the income of a city, only 20% goes to the national government. I've seen it work. But one of the more important premise or feature that allows devolution to work is a strong sense of accountability of public officials and a strong political the strong participation of people in the political exercise. Kumbaga, it happens kung wala kang political clans that control your politics at the local level. Kasi madaling napapalitan yung mga officials if they don't function well. So devolution in those instances can work. And I've seen it work in a country where the people have a strong recall. They can actually recall a person for being part of the city council but is not functioning. But dito sa Pilipinas, wala pa tayong ganong level of strong political maturity at the grassroots, at the local government units. So, napakahirap siyang igpawan. It's a very big challenge that we need to address. And let me just add that while devolution is one very glaring problem in our healthcare system, there's so many other health problems, and all of these are tied together. I just remembered na kahit masolve natin yung devolution, halimbawa yung issue of health human resources, hanggat hindi natin inaayos talaga yung ibang problems of the healthcare system, it's just gonna be a temporizing solution.
I was going to ask, particularly for example, sa human resource, how do you get rid of this ultimate irony in the Philippines, where you have a surplus of nurses as well as a shortage of nurses?
Yes, it's very well. We've always had a labor export policy, which means it's really not a choice for a nurse, for instance, to stay here, because staying here means working your ass off and getting poor remuneration for it. Whereas working at the same level in another country gets you not only better compensation but a better lifestyle and career option. So it's hardly a choice for nurses here and other health professionals of staying here. Plus pa, there were instances in the past that other countries really needed additional nurses. So they upped the ante, kumbaga. They added additional features. So yung pull factor ng ibang countries, pas yung push factor natin, ang hirap. So what we've been trying to tell government is, baka kailangan alagaan talaga natin yung mga nurses natin dito. So it becomes a real choice. If you talk to, let's say, our nurses here, they don't want to leave the country. But they're seeing how nurses are being treated here now. Imagine, it took forever for them to get a section of the Nursing Act, the one about compensation. It took them forever to get that passed. Tapos ngayon, it got passed. It resulted in demotion of other nurses.
Yeah.
Di ba? Nagka-demotion issue pa. So, kung ikaw ay nurse, nagtatrabaho ka sa gobyerno, and honestly, yung gobyerno na ngayon pinakamataas magpasahod ng nurses as compared to private hospitals, for instance, ganon pa trato sa'yo. So you can just imagine the difficult position of nurses. And here comes an offer to work abroad. And you're working at the same level of difficulty. Pero at least, mas malaki yung kita mo, naaalagaan, napadalan mo yung pamilya mo, natutustusan mo yung pangangailangan mo. So it's always been that. It was never a real choice for nurses or other health professionals to stay here. And the pandemic has actually shown how very little the government is doing in that regard. Can you imagine? Why can't government recruit now in the middle of the pandemic? Kasi yung ino-offer nila, hindi naman ganun kataas. And if you look at what they're offering the people coming in from Cebu, natuto na sila. May mga dagdag na. The compensation is actually much higher than what they're actually giving currently employed nurses. If you look at the compensation package ng
So nagkaka-distortion patuloy, ano?
Oo, nagkalaki. Pero kasi Lucy, lang naman sila, 3 months lang eh. So, yan din yung nakikita natin eh. Contractual sila. Contractual yung obligation nila, bigyan mo na sila ng malaki para mapastay mo sila dito. Actually, we've been calling for that in Second Opinion. We're saying, give them attractive packages for them to actually consider staying here and joining the fight, because right now, we need everybody. Hindi pwedeng volunteer, hindi naman pwedeng papag-guilt trip pa natin at sabihin, hindi kayo makabayan pag hindi kayo nagstay dito. Yung mga ganon, hindi yun yung proper approach. In fact, before we saw, yung kahit sa doctors, we saw doctors moonlighting in hospitals outside Metro Manila. Pero ayaw nila mag-join dito sa Metro Manila. Bakit? Kasi mas maganda yung package, mas may leeway sila to move around. So why can't we offer something like that? In the middle of the pandemic, maybe just hire them for 3 months, 6 months, and then look at it again.
Okay. Dr. Nisperos ng Second Opinion. Doc, maraming salamat for joining us tonight at ingat po.
Maraming salamat din po.
Thank you, Dr. G.
Thank you. Thank you po.
We will just go into a break, so please stay with us.
Welcome back, the Chiefs. You're now in the final stage of our conversation. Now joining us is Dr. Rontgene Solante, Chair of the Adult Infectious Disease and Tropical Medicine Section of the San Lazaro Hospital. Welcome to the Chiefs, Doc.
Hi.
Good evening, Doc.
Good evening.
Hi, Dr. Solante, you're also a member of the vaccine expert panel. Now, in the past few days, hindi lang maraming balita tungkol sa vaccination, marami ring mga developments sa vaccines themselves. Maybe let's start with that. On the one hand, give us an update and clarification. What do people need to understand on Sinovac for the elderly? Kasi ngayon, sinabi, papayagan na raw ang Sinovac for the elderly. And then sa kabilang banda naman, what do we need to understand about AstraZeneca for people 60 and below?
Okay, so we'll start with Sinovac. No? So we now allow the use of Sinovac for those 60 years old and above, no? Which initially we did not recommend based on the initial EUA FDA approval. No? So this decision was carried out based on the premise that our vaccine supply, we don't have a vaccine for those 60 years old and above, which is supposed to be AstraZeneca. And given the situation now that there is ongoing community transmission, surge of cases, and we look at the number of 60 years old and above that are in the hospitals right now, who are with severe, moderate, or critical, these are the populations that are occupying, I would say, 80 to 90% of the hospitals in our NCR bubble plus. No? So we need to act now. And the one option there is to allow giving this vaccine to 60 years old and above, even with the lack of data based on a phase 3 clinical trial that this vaccine is effective for the 60 years old and above.
Sir, so effectivity po yung...
If I could just clarify kung tama po yung narinig ko. I mean, first, dun sa advisory nung una na hindi muna tayo magsa-Sinovac para sa mga matatanda, what was the basis for that? Was it a concern for safety or was it a concern for efficacy? Because ang naririnig ko po kanina, correct me if I'm wrong, is basically hindi talaga sa amin nire-recommenda, kaya lang walang AstraZeneca eh. So payagan na muna natin. So what was yung concern na kailangan natin i-hurdle first? Was it safety or efficacy?
So it's not the safety, but it's more of the lack of the phase 3 trial data of efficacy. Dahil meron sila doon sa phase 3 data na may mga 60 years old and above na healthcare workers, pero there were only very few. So it is underpowered to make a conclusion if the vaccine is effective or not, no? So yun yung hinintay sana namin na data. But the phase 1 and phase 2, kasi pag nag-evaluate tayo ng bakuna, we always bridge these 3 clinical phases of development. The phase 1 and phase 2 data, in terms of immunogenicity for more than 60 years old, are very good. So ibig sabihin maganda ang antibody capacity ng 60 years old to produce an antibody against COVID-19. Ngayon lang, nung sa phase 3, hindi na natin na-test yon in an actual trial na na-expose sila doon sa mga COVID-19 patients because the number of participants sa 60 years old and above was too small.
So what made you decide nga now? Do you have enough data, for example, to make a decision na pwede nang ibigay sa seniors yan? That it's not just being given out of a need to vaccinate kasi wala ang AstraZeneca.
It's basically the phase 1 and phase 2 which established that it's safe, and it's also immunogenic, no? So safety and immunogenicity sa phase 1 and phase 2. At hindi lang doon sa phase 1 and phase 2, tinitingnan din natin kung paano nagro-roll out ng ibang bansa despite this lack of data sa 60 years old and above. Like number 1, no, yung sa Indonesia. Then you have Turkey. They have vaccinated millions and millions now of 60 years old and above. Then we have Chile, then Hong Kong, and then of course China is the biggest of these countries using Sinovac for 60 years old and above.
Pero doctor, dati nang available yung anong yan hindi ba? Dati nang available lahat yung data na yan eh. Ano yung nadagdag ngayon to make you change your mind at this time?
Yung sa ang isa sa mga important na kino-consider namin is it is being used by other countries also for the 60 years old and above.
Dati na nilang ginagawa yun hindi ba?
No, yung Indonesia na une. So marami-rami na yon, di ba, Doc? Tsaka
yes,
yung mga ibang countries, they vaccinated Sinovac ahead of us. So they would have data already. So you're saying, Doc, na yung kunyari Indonesia, they actually gave shots to seniors in Indonesia even before it could be established nga? Ganun ba yun? Kumbaga, sila yung naging phase 3 ninyo. Parang ganun.
Oo, kasi ang itong mga bansa na to, no, like Brazil, like Turkey, no, they already have millions of doses of Sinovac, even if during the time na hindi pa tapos yung trial, no, they have this advance order of the Sinovac because they believe that with the phase 1 and phase 2, meron talagang laban ang pag nababakunahan ka dito.
Nagpa-inject nga
Doc, for
si
clarity lang, Doc,
President. Saka si
Doc, for
ano,
clarity lang, balikan ko lang yung tanong ni Ruby. So just for clarity, so hindi po question yung safety doon sa Sinovac. It was
Yes.
never a question. Just to be clear,
Yes,
it was never a
correct.
question.
Yes.
The question lang talaga that had been resolved in the last few weeks was the issue of efficacy.
Yes.
yun namang sa AstraZeneca, anong nangyari? Bakit? Or you just worried about the World Health Organization report? Yun lang o may dagdag pang reason in the Philippines, unique to the Philippines?
Of course, so ganito, no? So actually ngayon, those who receive the AstraZeneca vaccine based on the National Adverse Event Following Immunization Committee, wala pang nakikitang event na nakikita doon sa Europe, no? Yung mga nagba-blood clots, no? The decision of the FDA to temporarily suspend the administration of Astra vaccine is we want also our local experts to review the data and at the same time to also look at how WHO look at this, despite the fact that even EMA look at this as there is a possible link, but they still continue to give the vaccine in most of these countries.
Okay, Doc, there are some people who already got AstraZeneca shots, their first dose. First question, what does this mean for their second dose? And second question, basically, what's your message to a friend who says na, Parigo, meron na akong first shot, paano ba to?
Okay, so doon sa data na blood clots, the occurrence of these blood clots is usually after the second dose, after the first dose. So I would say, in my understanding, those who are given the first dose and nothing happened to them will be receiving the second dose.
Mm. So yung mga nagkaka-thrombosis or yung mga cases na ganun, after the first dose, within 2 weeks, I understand, no? Parang
Yes,
ganun daw
ganun yun.
yung lumalabas na
Yeah,
data.
tama.
So,
And then,
so
sa
kung
mga
hindi
bata,
nag-manifest, yes, sa mga below 60, right? Pero kung hindi nag-manifest, are we saying it's safe to go on with a second dose?
yes.
Okay.
So,
Kasi
gano'n
ang tinitingnan natin dito yung the benefit over that risk, no? Like currently, as based on the estimate of the EMA, this is an occurrence of like 1 to 5 in millions, over millions of those given the vaccine. So napakababa talaga ng odds of getting this, no? And the benefit is what we are looking at na ang ganda nitong bakuna in terms of efficacy, in terms of protection, and this is how small the benefit, the risk is. Then that's the decision that most countries still continue to give the vaccine, even in those less than 60 years old.
Sir, we're asking, of course, not to scare the people who already have AstraZeneca shots or have schedules for it, but we also don't want them engaging in any risky behavior, diba? Because I can imagine some people now thinking, does it make sense to forgo my second shot and go for another first shot? What are the risky behaviors that you also want to clarify and stress to people so that one, they don't panic, and two, they understand what are things to avoid, even if they're concerned.
Okay, so in terms of those who have been vaccinated, this will still continue to be observed, no? Kasi ganun naman ang protocol natin, no? Until such time you get the second dose, and then you'll get the second dose, you'll just have to monitor and report any adverse event that you feel na naramdaman nyo na hindi normal, no? Pangalawa, I would really assure them, no, na at this point in time, kung nabigyan kayo ng first dose and you are already like 1 month or 2 months detached from that first dose, I don't think there will be occurrence of that particular complications na nakikita doon sa ibang bansa, because the occurrence here is mostly during the first 2 or even the 3rd week of the vaccination.
In the meantime,
Doc?
Doc, kumustahin ko lang. Kumusta na po ang San Lazaro Hospital ngayon? Kumusta na yung
Yeah, so we're
are you stepping down na yung sinasabi ni Yusek Barrere, magbabawas daw ng mga mild and asymptomatic?
actually ang mga admission namin is 80% severe and critical, no? And in the remaining 20% are the moderate. So talagang lahat ng mga admissions namin talagang kailangan nasa hospital, and we're so glad na mga referral hospitals na nagdadala ng mga pasyente sa mga hospitals namin. May mga ngilan-ngilang na mga mild, no, or including those mga healthcare workers. We really have to admit them, but mabilis din kaming mag-discharge sa mga pasyente na hindi na kailangang magtagal sa hospital.
So hindi
Pero
naman
kumusta na kayo?
Doctor. Hindi kayo
Yes, Doc, kasi
overwhelmed.
bumaba na rin yung R0 daw. So, nararamdaman nyo ba na nabawas-bawasan na ang pagpasok ng mga pasyente?
Ay nako, Luce, hindi pa kasi we average like 10 to 12 a day. Mataas
wow,
pa rin.
yeah,
Hindi,
taas pa rin.
Ano
ewan
yung
ko
normal
kung
ba? Ano ba yung
Versus
normal?
how many discharges, Doc?
usually ang
Versus how many
discharge namin so mga ano yan, 6 to 8 yan a day. Mabilis naman ang discharge kasi
so may
yung
net pa
mga
rin. Mhm.
So, laging may
Oo,
shortage. Parang gano'n, may discrepancy. Yeah.
pero
So,
konti na lang yung bakante, but kaya nga swerte-swertehan lang kung sinong makakuha ng bed.
Oo, kasi Doc, narinig ko kayo na nag-double, triple na kayo sa
Yes.
isang ICU unit or room, no?
Thank you,
Yeah,
Deacon.
Ganun pa
correct.
rin ba? Yeah, ganun
Yes,
pa rin ba ang
yes.
situation? Oh, wow.
In one
Yeah.
room we have 4 critical, ha? So naka-monitor yan in one room, and then we have how many rooms that merong ganon? 5, 6, 7, 8 rooms. So you can just imagine, no, the healthcare workers task, no, na talagang nakakaawa talaga taking care of these patients. But I still believe na talagang grabe ang dedikasyon ng mga healthcare workers, mga frontliners natin.
Yeah.
Okay,
Alright.
Dr. Rontgene Solante. Doc, maraming salamat for joining us tonight at mag-ingat po
Thank
kayo
you,
palagi.
Doc.
Thank you, Doctor.
Thank you. Stay safe.
Stay safe po. And that'll be all for this Thursday edition of The Chiefs. Isang araw na lang at Biyernes na po. We hope to discuss here. We'll keep the conversation going. Remember, mask on, wash hands, and stay safe, Philippines. I'm Adrica.
I'm Ami Pamintuan of the Philippine Star.
I'm Lucy Cruz Valdez of News 5.
I'm Robbie Alampay, and we are One News.